Before we dive in our main topic, which is the exercise for cardiopulmonary disorders, first we have to talk about what is cardiopulmonary disease. Cardiopulmonary disease is the medical term used to describe a range of serious disorders that affect our heart, which is our cardio, and the lungs, which is our pulmonary. These two organs are closely connected because one problem can affect the other. For example, if our heart couldn't pump blood efficiently, normal oxygen movement from the lungs, it reduced, causing us to have or to experience short breathing. On the other hand, problems with the lungs can also affect our heart, which it can the heart will work harder in order to get the oxygen from the lungs to the blood and to the body. So, signs of cardiopulmonary disease can vary widely depending on the specific condition. Some common symptoms include first, the bluish skin on the hands or feet. Second one, chest pain that may radiate the arms or jaws, especially during physical activity. Dizziness or lightheadedness. High blood pressure, nausea and vomiting, shortness of breath, sudden sweating, and wheezing. So now, cardiopulmonary disease has two types, which is the cardiovascular disease and chronic obstructive pulmonary disorder. And the difference between these two conditions is found in the organs where the illness originates. So now let's talk about the cardiovascular disease. Usually used in relation to a condition where the vessel has become blocked, which increases the risk of heart attack and stroke. Okay. This disease is the umbrella term for other diseases affecting the heart, which includes coronary artery diseases, blood vessel diseases, heart arrhythmia, and heart defects. There are risk factors for cardiovascular disease. So first is the unhealthy diet. You have to eat proper diet in order for you to be healthy, to keep your health healthy, and with that it can take you away from the risk to have a cardiovascular disease. The second one is the physical inactivity. Yeah, you will be at risk if you cannot engage in some activities, physical activities. Yeah. And the third one is the tobacco use. As we all know, it is one of the reasons why people has heart disease. And lastly, harmful use of alcohol. So it's okay to drink alcohol, but in a moderate way, not too much. Chronic obstructive pulmonary disorder is a common lung disease causing restricted airflows and breathing problems. Sometimes it's called emphysema or chronic bronchitis. Smoking and air pollution is the cause of chronic obstructive pulmonary disorder. Symptoms includes cough, sometimes with phlegm, difficulty breathing, wheezing, and tiredness. This disease is not curable, but it can be better if you don't smoke or stop smoke and avoid air polluted area. And it can also treated with medicines, oxygen, and pulmonary rehabilitation. So there are 3 types of exercise if you have a heart problem. The first one is the aerobic exercise. The second one is the resistance training. The third one is stretching, flexibility, and balance. According to Johns Hopkins, aerobic exercise and resistance training are the most important for our heart health. According to Carrie J. Stewart, aerobic exercise improves circulation, which results in lowered blood pressures and heart rate. And it increases our overall aerobic fitness as measured by a treadmill test, for example. And it helps our cardiac output of how well our heart pumps blood. If you are someone who has a heart problems, aerobic activities like walking, running, or jumping ropes gives your heart and lungs the kind of workout they need to function efficiently. We have also breathing exercise. In particular, it can strengthen your diaphragm and train your body to breathe more deeply and more efficiently. Aerobic activity uses your heart and lungs for a period of time. It also helps our heart to use oxygen better and improves the blood flow. But remember to start slowly. And when you engage in physical activities, you have to do a 5-minute workout and stretching to warm up our muscles and heart before doing the exercise. Always put in mind to start in moderate to hard. So another exercise if you have a heart problem, is the resistant weight training. It has a more specific effect on a body compositions. According to American College of Sports Medicine, attest 2 consecutive days per week of resistance training is a good thumbs for a person who has a problem in the heart and the lungs. For example, working out with free weights such as hand weights, dumbbells, or barbells, and also on weights machines with resistant bands or through body resistance exercises such as push-ups, squats, and chin-ups. Okay. The last one is the stretching, flexibility, and balance. Stretching exercise can help improve our flexibility and range of motion, making everyday activities easier and reducing the risk of injury. This exercise don't directly help or contributes to the heart, but it can benefit our musculoskeletal health. For someone who has problem in cardiopulmonary, you have to seek a doctor for your exercise, for you to be able to have a prior understanding about your condition. And also always put in mind to avoid polluted area when you do some certain exercises. Avoid smoking. If you have a problem with your heart, the person you have to seek is the cardiologist, as they are the experts of the heart problems, disorders, or disease.